Hello, we are Team 1, comprised of James Bisacca, Maggie McGrath, Neda, Imam, and myself, Sabrina Payne. This is an industry analysis on ultrasound devices. Ultrasound devices use high-frequency sound waves to reflect off tissues, which are converted into a picture called a sonogram. This is a non-invasive technique to retrieve an inside view of the body. Most people think of fetal ultrasounds that are typically performed several times during pregnancy to ensure normal fetal development, but the same technique can be used to view your other internal organs and even blood flow through veins and arteries. This is the most common use of ultrasound devices for diagnostic purposes. The smaller but faster growing segment of the market, using ultrasounds for therapy, adjusts the rate of sound waves to cause vibrations, which can treat cancerous tumors and even gallstones. Taking a look at the competition in this market, there's a mild duopoly where General Electric and Philips dominate with a combined market share of 54.4%, followed by numerous other companies at much lower revenues and market shares. We can see the two main uses broken out, where 2D, 3D, 4D, and Doppler ultrasounds are used for diagnostic purposes, which currently has 92% of the market and a compound annual growth rate of 2.5% expected over the next 5 years. Therapeutic ultrasound is comprised of high-intensity focused ultrasounds and extracorporeal shockwave lithotripsy, which is currently only 8% of the market, but expected to grow to 10.2% by 2023. This is a much higher growth rate of 8.3%. Together, the medical ultrasound device market has a consistent upward trend, right now sitting at over $6.7 billion in revenue, but expecting a 3% annual growth to over $7.8 billion by 2023. Now on to Neda for the market segmentation.
Thank you, Sabrina. Here we are going to discuss the market segmentation. The ultrasound market can be segmented on basis of instrument products, end users, and clinical applications. Here we can see segmentation by instrument products that although cart or trolley based instruments have more market share, but the compact or portable ultrasound has fastest growing rate with CAGR of 5.7%. Similarly, we can see the segmentation with end users that the diagnostic center utilizes ultrasound more and has the larger market share, but the hospitals have higher growth rate or CAGR in comparison. But the most important segmentation is based on clinical application. As our team member Sabrina just mentioned, the clinical application can be based on diagnostic or therapeutic application. Out of the two, the diagnostic application carries 92.5% market share, while the therapeutic application has only 7.5% of market share. As the diagnostic application carries higher market share, if we further divide this application, we can notice that the diagnostic application has highest value in 3D and 4D ultrasound, which consist of about 52.8% or $2,942 million. The 3D and 4D ultrasound is also the fastest growing with CAGR of 5.4% in comparison to 2D ultrasounds, the Dopplers, HIFU, or lithotripsy ultrasound techniques. Also note that 3D and 4D ultrasound is utilized for majority of its application in cardiology field in order to visualize the heart wall motion, or in OB/GYN field for the visualization of fetal structures, congenital defects, etc. If we look at the pie chart and see the application of ultrasound in medical field, we also notice that cardiology branch has the fastest growing with CAGR of 6.2%. Hence, we can conclude that the diagnostic application, specifically in 3D and 4D ultrasound in cardiology field, can be very useful in the future to come. Now to Maggie for stakeholder analysis.
Thank you, Neda. Taking a look at non-market forces in ultrasound, 3 factors that heavily influence the industry's development are public policy, technology, and consumers. Ultrasound machines are subject to federal regulation through the FDA, who categorizes each instrument according to the risk inherent in each device. The classification system assesses devices for their intended use and indications for use, and creates requirements for approval based on these criteria. In addition to government regulation of safety and efficacy, ultrasound devices must prove their cost efficiency and medical necessity to garner reimbursement approval from healthcare payers like CMS or private insurance companies. Point-of-care ultrasounds are evolving with enhancements to technology. Mobile capabilities and cloud connectivity offer access and integration into the medical health record while capitalizing on portability and ease of use. Advancements in sensitivity, resolution, and computing improve the diagnostic capability of medical devices, where previous blips on the radar are now 3D renderings of field development, and a simple attachment allows cell phones to become portable ultrasound machines. Factors such as aging, progressive health conditions, hypertension, secondary medical conditions such as cardiovascular and other serious medical conditions mean the sales of ultrasound devices are expected to increase due to technological adoption of ultrasound devices in hospitals. Addressing who are the patients and what do they need is a driving force for the development of ultrasound technology. There are many stakeholders who will benefit from the development and placement of point-of-care ultrasound machines into the diagnostic point-of-care ultrasound market. Hospitals are a key stakeholder of high importance in the point-of-care ultrasound market segment. As the primary target consumer, hospitals purchasing point-of-care ultrasound for specialty departments will benefit from faster and readily available diagnostic technology accessible to a wide scope of clinicians for a multitude of clinical indications. Medical professionals such as nurses, advanced practice providers, and physicians are key stakeholders who will be able to quickly and efficiently provide services within their scope of practice, such as cardiology, urology, and vascular access. Providers and payers alike will benefit from a cheaper, less invasive, billable service that can be coded and priced by procedure or indication. Patients can receive safe, fast, effective diagnoses, all more likely to be covered under reimbursement models than more elaborate or invasive diagnostic tools. Collectively, stakeholders can capitalize on the accessibility, affordability, and efficacy of entrance into the point-of-care ultrasound market. And now to James for emerging trends.
Thank you for that analysis, Maggie. Trending in ultrasound is the utilization of cloud-based application storage. Not only does this trend represent innovation in itself, it is driving further innovation industry-wide through its enablement capabilities. Cloud-based storage and applications are leading to broader access to data utilizing shared networks, driving cost savings by allowing facilities to move away from document storage and enabling online data warehouses to be utilized to their fullest capabilities, and lastly, driving further innovation in ultrasound through the advancement of artificial intelligence. Cloud storage has also created its own market within medical devices, with major players being Amazon Web Services, Microsoft Azure, and Google. As the ultrasound market continues to develop, cloud-based application and storage will continue to allow innovators in the space to develop more cost-effective and efficient ways to utilize and advance the technology. Please see below for a list of our resources during this project.